Hi there, I'm Dr. Stephen Phelan. I'm going to do a quick Facebook Live. I wanted to share a rehab case I'm seating this week. And let me just see that this is working. Let me look on my other computer because I've logged into the Phelan Dental Seminars Facebook page on my other computer. And this should show me, yep, it's working. So basically what I wanted to do is share some of the records and some of the things that we have for a rehab case. If you don't know me, I'm Dr. Stephen Phelan. I have a dental practice here in Oakville, Ontario, Canada, focused mostly on rehabilitation type of dental cases, so full mouth partial rehabilitation, as well as cosmetic cases, so porcelain veneer type of cases, or dental implant cases. The other thing that I do is I teach clinical dentistry. So I teach how to do this kind of dentistry, how to do these kind of cases, things like a rehab case such as this. So I teach this kind of dentistry. If you're interested and you're a dentist and you're interested in this kind of dentistry, you can go to my free webinar, free online seminar called Altering the Vertical Dimension Case Studies. You could go to this at vdoseminar.com. So it's, I believe you could write in https:/vdoseminar.com, or just write vdoseminar.com and it'll direct to the correct page for that. I put the link in the description of the broadcast. So what we're going to do today is I'm going to share with you this rehab case. So here is the diagnostic wax up for a rehab case that I'm putting in this week. You can see it's a full mouth rehab case, mostly tooth supported restorations. There's a couple of dental implants supporting a couple of posterior crowns in the lower. Those have already been placed. So we've placed the lower arch. We've then tested the upper provisionals to the lower arch that's already completed. We placed the lower arch after testing the provisionals, upper and lower provisionals together, but then we placed the lower arch. We tested that to ensure that everything's good with the new finished lower arch against the upper provisionals, and now we're ready to place the upper final restorations. The final restorations are a combination of two materials. I've got them here. That's why I'm wearing the black gloves. Let me show you them. I'm going to put my hand under this so I don't drop these, but I have a table that's covered with velvet in case they drop, so that's soft. But here's the upper rehab. I'll put it right there so you can see this. Now, if we show you this way, let me just put it like this so you can see. What I'll do is I'll try to take some pictures of this after and just post them in the comments below so you can see this better. The front 6 restorations are porcelain veneers. They're feldspathic porcelain veneers built on refractory dies. So you can see right here, they're very thin and fragile until bonded. So what the advantage of that is, we really do save a lot of tooth structure over traditional crowns. So there's actually, that's a good image of a feldspathic porcelain veneer. They kind of wrap between the teeth because of the spacing between the teeth. So we've wrapped a few of them. I don't prep the contacts open on all cases, but this case had a diastema between the centrals and kind of a bit of a funky contact between centrals and laterals. So we did open up the contacts in those places. I didn't open up the contact between the lateral and the cuspids because there was no need. So traditionally, I don't open the contacts if I don't need to. They're veneer preps, so you can see here, going over basically the incisal third of the preparation. The cuspids overlap on one of them, overlaps a fair bit. It's more of a V-shaped veneer, so this one overlaps a fair bit because we wanted to increase some guidance on that particular tooth. So we wanted to add some cuspid guidance in porcelain. We did add, the design, we added contour on the lower arch with porcelain, but so that we didn't make the upper or the lower cuspids look over contoured, we've added some on the upper cuspid on the palatal also. Not as much on the right side, more on the left side. You can kind of see the design of the preps right there, right there. You can kind of see it. So that's kind of good. So basically, the front are feldspathic porcelain. I'll try and show you this again without, maybe if I block it, you can see better. It's hard to show this on a camera when I'm filming live, but let me try this way. That might be a good way to show. Yeah, without losing the restorations. It's a bit of a challenge. So that's the upper arch. The front are feldspathic porcelain. The posteriors, which I can show this way easily, are zirconia. So typically what we do is we layer the buccal cusps in feldspathic kind of layered zirconia porcelain, and then the occlusal and palatal and interproximal is full contour zirconia, and the second molars are pretty much fully full contour zirconia. But we do layer in the buccal cusps for aesthetics in a more, I guess it's really a feldspathic porcelain that gets layered. It's a zirconia porcelain. So this is that particular arch. Here's the wax up. You can see the preparation design on the veneers on the wax up as well. So that's there. And let's see, feldspathic porcelain. I'm bonding these in Wednesday. And with the feldspathic porcelain, I usually I get asked this, usually use 3M's veneer cement. And in my case, I like to use 4th generation adhesive. I've had great success with that over almost 30 years in practice. So the 4th generation adhesive I use is Optibond FL adhesive. So it's a separate 2-bottle system, 1 bottle of primer, 1 bottle of adhesive, and they just don't come off. The other thing that we do with our preps, especially for veneer cases, is we do not prep too deep into dentin. So we try not to strip off all the enamel. You can kind of see here, preparation design does not have aggressive deep preps on the facial and even the incisal. The facial enamel is really critical with veneer cases, so we try to leave as much facial enamel as possible. Of course, this is dependent on the position of the teeth before you start. There might be one tooth that's rotated out a little bit, and we have to prep that a little bit more, so we can't be quite as conservative. But assuming the teeth are lined up reasonable, we can go more additively with the porcelain veneers in many cases, and that allows us to be more conservative, leaving more enamel to prep, to leave for bonding of the case. So this case, the veneers are all 3/4, probably more than 3/4 of the surfaces are enamel that the veneers will be bonded to. Even these palatal areas that I showed where we added veneer for guidance, even that's prepped such that it's still going to be largely on enamel there. And so that'll be bonded in on Wednesday. I did share the preparation of this upper arch with one of my occlusion design members webinars. So this upper arch, we shared preparing it with video that I filmed mostly in my LuxCam video camera. So it's a camera that attaches to my loops, but I also filmed some of it with my Zeiss microscope. So I kind of, when I'm prepping an upper arch, I don't do the whole thing in the microscope because it's hard to get a good feel for how all the preps interrelate because it's so specific to certain areas. So I usually rough prep them with the loops and then go for the details with the microscope. That's typically what we do. So I had video from both mechanisms. So that I shared with my members, I believe in, I think it was November's member webinar. We shared the video for preparing this case, the upper arch for this case. I don't think I've ever shared the bonding in of the lower arch yet, but I could at a future member webinar. And I'll videotape everything that I'm bonding in this week, so I could, again, potentially share that on a members webinar. It's nice to be able to have these as content, because each case has different unique things that are neat to that case that we want to be able to share. So that's basically kind of what I wanted to share today, showing this beautiful porcelain work. Oh, the porcelain work for this case was completed by master ceramist Harold Heindel. Harold's not actually on Facebook, so I can't reference his page or anything. He just doesn't go on and doesn't have a Facebook page. But what I'll do is I'll try and post some pictures in the comment section so you can see this. If anybody's on live right now, I make these videos more to share with people on my email list in my online community, so I could email out and let you have a look at it and look at the videos. But if anybody's live right now, you can answer or ask a question in the comment section, or make a comment, question, whatever you'd like. If you're watching the recording of this and you'd like to make a comment, over the next week or so, I'll try to go in and answer some of the questions or comments that are left below in the comment section. Sometimes they get, you miss them when you scroll down, but I'll do my best to go in and answer a few of them in a couple of days. And if you have questions about the procedure, and if you like this, by all means, thank you for giving us a thumbs up. That's great. And that's Silda, I believe. Sorry if I'm not saying your name right. Hello, hello. Are you a dentist, or maybe you're looking at my page as a potential patient? I know the Phelan Dental Seminars page I kind of created mostly for dentists, but it ended up a lot of potential patients are watching these videos and looking at the content on the Phelan Dental Seminars page. Originally, I intended to have Phelan Dental Seminars as the page for dentists, and then the Dr. Stephen Phelan page, which you may or may not have seen, as the page for patients. But it kind of migrated and got mixed up, and different people look at different both pages. Oh, you're a dental student. That's neat. Where are you from? Are you from Canada or North America or outside of North America? I guess you wouldn't be from Europe. It's really late in Europe. It's just too late for, well, you never know, but not likely. Once again, I'll show some pictures of this in the comment section later. I'm going to take some photographs of this next with my camera set up, so that will be available to see. And then I'm going to share this with the members at some point in the next few months. I have a lot of different cases that we're planning to share with the members. Today I bonded in some central incisor veneers. It was an interesting case. We used the rubber dam to isolate the veneers for bonding. Don't know that I'll share that case. I did videotape some of it though. Tomorrow I'm bonding in an 8-unit veneer case. The 2 bicuspids though are jacket crowns, and then the 6 anteriors are porcelain veneers, much like this, with some spacing between them. So they're prepped very similar to this. So that case I'm bonding in tomorrow, and then Wednesday I'm bonding in this full arch case. So that's what we're doing next. So that's basically it. If you have any other questions, what you could do is ask them below this video or in the comments section. I'll go in and try and answer them. If you're interested in rehab type of cases, go to videoseminar.com. The link is in the description. And that is Altering the Vertical Dimension Case Studies. It's a free webinar where I share, the main concept that I follow to alter the vertical dimension and to figure out what vertical dimension we would build a case like this at on the articulator when we're trying to do a full mouth rehabilitation case. Most of the rehabilitation cases that I see need some form of vertical dimension increase. Many of them have worn down over time, and if nothing else, what we need to open the vertical at least a little to create room for restorative material. So we need room for restorative material to be able to have the space to restore the teeth in a nice manner. So this case, we opened the vertical dimension actually a fair bit because her lower posterior teeth were worn down quite significantly. In fact, on this side here, on this side, the lower teeth had core buildups and the upper teeth were touching the core buildups. So we had to open the vertical to have room because the core buildups couldn't be prepped much more occlusally. The teeth would have had no retentive form. Even with bonding, that just wouldn't have worked very well because they were gold post cores. So we needed to open the vertical to create room for restorative material. I wanted to be able to manage the guidance better too. So opening the vertical helps me manage the guidance and keep the guidance angle at a manageable angle and be able to just have room to lengthen the teeth as well. We lengthened her teeth, might have been about 1.5 mm to 2 millimeters. And we didn't want to create a really deep overbite after lengthening the teeth, and I didn't want a really tight overjet. So opening the vertical helps manage all of these things with a rehab type of case. So you can go to that webinar. What's it called? It's vdoseminar.com. And we'd be happy to share that with you. It's a free webinar training for dentists. It's not really designed for patients. I don't think you'd find it very interesting. It probably would be a little dry as a patient, but for dentists, I show 3 different case studies that I'm treating with rehab cases, and 3 different case studies that use different concepts, well, kind of the same concept, but different parts of the same concept for creating the vertical dimension position. Because, you have to ask yourself, what vertical dimension would I actually build the case to, and that's a question that we answer during the seminar. So once again, that's basically it for today. This is a case I'm bonding in this week. Tomorrow I'm bonding in an 8-unit case, but I don't have that unpacked. But I'll share with you this case as we just did. I'll post a couple pictures of the case. It's very hard to see in a video. This is my MacBook Pro FaceTime camera, which is 720p. And, it's very hard for you to see and appreciate the beautiful ceramics that Harold did for this case by looking at it just in this kind of format. But if I take a picture, you'll really see. And there goes one of the crowns. It's a good reason to have velvet on the table. Whenever I'm looking at the cases and photographing them and inspecting them, I always have velvet on the table. So if they fall, they'll hit the velvet, which is soft. And it's a good background for photos. So these are all good things. So there's the case again. It's hard to see with yeah, you can see it there. That's actually not a bad way to show it in a video like this. I did try to shoot some video at 1080p, which is more accurate. I'll see how that looks, but I probably wouldn't post that right away. Maybe I'll post that in a webinar, because that takes a little editing, a little editing work with the high def video. So that's basically it. Thank you for joining me, and we'll talk to you soon. Take care. Thank you.